I'm Shane Bayless, Doc Hockey. Today I want to talk to you about balance. So let's get right into it. Why is balance so important? Any takers? Well, I'll help you out. It's probably the fact that you don't want to fall. A lot of people start getting really anxiety or uptight about falling as they get older. And it is quite an important thing as it affects your functionality and being independent, right? You have to pull people in to maybe help you out, especially if you've fractured your hip or have injured yourself so you can't move around as well. Now, balance is really important from a walking to a standing to just knowing where things are in the world. So it encompasses quite a bit of our ability to function in the world. So balance basically accounts for a few systems: our proprioceptive system, so our sensory system, how our body interacts with the environment around us, what it feels like. Vestibular system, which is our cranial nerve 8, it's kind of like our hearing and balance, what it works together to help our body. Vision is the primary system. Really, our use our vision quite a bit for our balance as well. Without that, obviously, we struggle a lot, especially if we've known what the vision system can give to us. Obviously, if we're blind, we don't have that vision system when we work with other things like our vestibular and our proprioception that is enhanced if we don't have that type of sense. Now, proprioception. This means, where am I in space? If you don't know where your hand is, you really can't move it that well, right? And that is often seen over and over again with people that have stroke patients and people that have brain injuries as well. It's also simply said body awareness, right? So when we're doing meditation, sometimes meditation is like, oh, don't think about anything, just get your breathing going. But we can do a body scan where you scan from the head to what your face feels like, to what your shoulders are feeling like when you're in the air around you, what it feels like, just getting more body awareness of every part that we don't think about when we're moving from day-to-day activities. Now, to test this, we often do like a 2-leg standing test with our feet together and arms across the body, and then we actually close our eyes. So why don't we get everybody up and we do that together. So just show you, right? So we come back, we have our feet together, right? Then we step up, arms across, okay? And then last but not least, we close our eyes, okay? And we see what we feel like. And there's usually some small tilt, either right to left, forward or back, just a little bit of a sway, just a little bit off balance, but you should be able to maintain that with 2 feet. It's not a super hard test to do, and you might think that's normal anyway. And shouldn't be that much of a problem for anybody. So our vestibular system. So this is our balance and hearing that we talked about before, the cranial nerve 8. There's 3 canals. So up here, as you can probably see, here's our horizontal canal, our vertical canal, and our diagonal canal, which is basically what navigates our dynamic balance, right? It tells our body where we are when we're doing motion. So athletics, moving around from day to day, dropping the head, moving it back up, just so that we know where we are and we don't get confused or feel nauseous along those things. Motion sickness in a car, this is a perfect example of people that are accelerating, but your body's actually not moving. So sometimes it gets confused for people because it hasn't adapted to this type of sense. And next thing you know, you feel nauseous because it's bleeding over into other nuclei that are nearby that creates that nauseousness. And vestibular nauseousness is like body pain. So muscle feel pain, your vestibular system feels nausea, a sickness, and like you want to vomit, okay? So testing this, you can do it by a canal isolation, we call it, or a foam balance test, which is a little bit even better because we're taking away the proprioceptive system. So a canal isolation test is the same thing that we did kind of before, right? If we have, everyone can stand up again, but basically what it is, we're standing here, our feet together, like I showed you before, arms are across, our head is here, we turn it to the right, and we close our eyes, and we hold that there, feeling how stable do we feel, and then we do the opposite way, to the other side to the left, and we turn, close our eyes, how do we feel? Which one feels more unstable? Usually that's the vestibular system that is actually working harder. So it's actually pulling you into that direction. So if I turn my head to that, it actually activates that canal. And now we see that it's turning. And then you can do it in all the different canals, right? That's just the horizontal one by turning the head and getting that moving, okay? Now the foam balance is even better, what I talked about, because foam balance takes away the proprioception, right? So You're closing your eyes, no vision system. There's no proprioception because the feet is on an unbalanced foam pad. And now you've got a balance with just your vestibular system. So that's a good way to determine how you're doing with that type of a system, the vestibular. Okay, now vision, like we said, it's a primary relied upon sense for your balance. Okay, so you look at eye alignment. How is the eye alignment? Sometimes you're shifted to the side, your eyes might not be aligned, or if they're not aligned, you want to shift the head to the side so you see everything at the horizon or straight across so that everything looks, it's straight in front of you. Now, trauma can affect this. So a car accident, slips and falls that you hit your head, or my favorite, which is a soccer ball to the head, which seems like every teacher that's out there at the recess or lunch hour that has a chance to be hitting the head with a soccer ball, because that's mostly what the kids play with. So always be careful for those flying soccer balls there, teachers out there. Okay, so how can we test our vision? Well, we've done it a little bit already, right? We're basically closing our eyes, but we always like to see this even better. So this is a great test for everybody to see how reliant we are on our vision. So let's get everybody up again, okay? This is an active talk here, right? Get people up, right? We're standing there, right? We want to put our arms across again. We're going to raise our leg up so you can see my knee come up. It doesn't have to be that high. It can be at 45 degrees, right? Get your balance there. Close your eyes and hold, right? So you're trying to hold that balance with your eyes closed. Okay, good job when you're doing that. And hopefully you can feel how unstable you are. Most of you probably touch the floor when you had your foot up there and you're trying to hold that balance. So, try to keep working on that if that's something that you want to maintain and work without your vision. So you're not rely upon that and you know how good your balance actually is. So what we do with our concussion people when we talk about balance, because balance is a big part of what we do, right? It's a pretty big key, especially since it navigates our postural muscles, because our postural muscles absorb a lot of energy when they're having to fire all the time. If our balance is off, our postural muscles are firing and they're basically consuming energy, which our concussion patients don't have a lot of energy to begin with. They need sensations to help with motor movements. So a lot of times their motor movements aren't as good. They don't have their good proprioception. So we need to enhance that as well. So sensation is better than just, okay, let's clench the hand, open it up. We need to know where the hand is, remember? So we need that sensation. Vision and coordination. This is an integral part to align them together. Vision and you need coordination together where things are so that things are moving well. Treatment. So how do we use treatment? For sensation, we use oils. Oils have an evaporation or a cooling effect. You can feel that it lasts for hours, which is really great. We use peppermint, sometimes tea tree oil. One of those adjustments to the foot, hands, even to the spine can help with proprioception, which activates mechanoreceptors in the joint and the joint capsule. Touch, even massage, tapping, chopping. Those things are all good. Vibration is another good one. It has its own pathway for sensation, which is great. We also use for the vestibular system calorics, which is basically putting water in the ear, which stimulates that vestibular system on that side, and then it stimulates the brain too. And that is really great because you don't actually have to do moving around if they have a hard time balancing to begin with. They can be laying there, and we do some calorics with pushing some water into the ear with a syringe. And then once those two are doing well, so your proprioception is doing well, your posture muscles are doing well, your vestibular system is doing well, the eye movements, they come along really quickly. So there's not as much, because if you do the two other systems and they're not doing well, sometimes the eye movements have a hard time actually being improved. So make sure you take care of those systems first. Now at home balance, to help static and dynamic balance. So we did the one leg standing. Now what you want to do is you're looking at like maybe a meter away where you're looking at that, you're staying on one leg, you're looking a meter away, then you look even further. So maybe a few meters after that, and after that. So you're looking further each time. So you're changing your depth of your perception of your vision. That will make your muscles change control when you're doing things. And then if you want to progress it even further, you start to look at the side. So looking at the side and then looking to the other side, which will help with our postural muscle control, as well as using our vision at different targets, which does change the way we balance as well. Now, to even increase that progression, you might want to do some head tilts, right? So I tilt to the side, and while I'm looking at something, I even turn the head to the side, or turn the head and then move the eyes, or move the eyes and then turn the head. Both those are good. Or limb activation. So we talk about that is maybe doing a teeter-totter back and forth with the leg, or having an arm outwards where it's swinging back and forth. All these things help you create more balance when you're actually moving things. Because how many times are we balancing and not moving anything? Static balance isn't as beneficial as dynamic balance, but you need static balance before you can get dynamic balance. So think about those things as well. If you want to improve your balance at home, keep practicing them regularly. So if you're wanting to help with your balance or concussion stuff because you have your balance that has been lost, think about us. We're at 308 Palladium Drive in Canada, corner Terry Fox and Palladium, 613-505-5000, proactivesportsclinic@gmail.com. Thanks guys for listening. I hope that was helpful, and let us know if you have any questions.